Hi guys, so for this week we decided to talk about ethics in medicine. I read up on the article by Peter Singer. Basically this whole article was talking about when it is morally okay in the medical field for death to occur. The two topics that I focused on, or the two arguments that he brought up, were is it okay to pull a plug on someone that is in like a coma-like state, that their best outcome is to come out in a vegetative state? Is it okay to pull the plug on them? And I believe that it is okay. I believe that it is okay for the family or the loved ones to make that decision. I know some people actually talk about it before this even happens, to say, hey, if this ever happens to me, I want you to pull the plug. But not all people talk about those type of things, but I think that it is morally okay. I know personally that if I was in that state, I would not want them to try to keep me on machines and living off of machines just to see if I could come out of it in a vegetative state. Because even the highest possible outcome, the best possible outcome, would be that I got most or half of my brain functions back, and I would still at that point I would realize that I am not the same person. I don't think the same, I don't function the same, I can't remember the same, and that would depress me even more. And so I don't think in any way that I would want to be brought back. I can see why it is controversial, because religious beliefs, and also the fact that some people do hear about doctors saying they're going to come out of this at best a vegetative state, and they actually come out of it better. So I can understand why people are very hesitant, because it is a very serious decision to have to make, and a very hard one. So I can understand why some people are on the fence about making this, or about saying this is morally okay to do. The next topic I just talked about was, is it morally or ethically okay for a physician to help assist in a suicide with a terminally ill patient? I said it was okay. I know I've read up on this a little bit before. I know that there is six states that allow this to happen. It's not written out in law, but it is held up in court that a physician can do this under certain circumstances. All the 6 states, all of them are out west, I'm pretty sure. I know California, Colorado, Washington, and Oregon. There's 2 more, but I can't remember the other 2. But yeah, there's 6 states that allow this so far, only 6. I believe, though, that it is okay for that to happen. For example, I read an article after this, a different one, about this girl who was 29 years old. Her name was Brittany, and she had already been diagnosed with brain cancer once, and she was able to get a handle on that. And then she came back to the doctor, and she found out that she had another brain tumor, and it was even more aggressive than the last one. And the doctor said that she, at best, could have up to 6 months to live. And at that point, she did a research, she looked at treatment with her family, and she realized that there's no way that she's coming out of this alive, with treatment or without. And she decided that she would rather die peacefully than have to sit and go through all of these treatments and suffer and be in pain for at most 6 months. And so she decided that she wanted to take her life peacefully, and her family, said, this is the best decision. We do not want to see you in pain anymore. And so that, in that instance, I believe that it is okay for that to happen, because when someone's terminally ill, they're not getting better, and so they don't want to suffer any more of the pain when they know that they aren't going to live, no matter what way they take or what decision they make. So I believe personally that it is okay for that to happen, for physicians to assist someone in their suicide if they are terminally ill, if they give consent. If they're under 18, I believe that they should still have the parents' consent and their consent, and maybe to cause less controversy, just in whole, just say, everyone that decides to do this, to say that they have to wait a certain amount of days or a certain amount of hours before they can confirm for sure that they do want to do this, to let them think it through and make sure that it wasn't just a rational decision, that they just decided this randomly. But I do believe that under 18, the parents should still give consent. It shouldn't just be the child. Some people actually say that the child just has to give consent. But baby steps with these controversial topics, you have to take baby steps, and you can't just go out and just say that. That's such a broad statement, or bold statement, I should say. So that was my opinion on the articles and the topics that were brought about.